In this video, shared by Dr. João Pedro Braga from Catanduva, Brazil, we discuss the management of Gore suture entanglement in a case of scleral fixation of an intraocular lens. This is the case of a patient with a dislocated intraocular lens in the vitreous cavity, in which the surgeon chose to explant the lens and perform scleral fixation of a micropure lens using CV8 Gore suture. After the scleral markings and the superior scleral tunnel are made, the trocars are positioned. At the beginning of the posterior vitrectomy, the dislocated intraocular lens is seen in the vitreous cavity. Corneal incisions are created to facilitate manipulation of the lens in the anterior chamber with forceps, and a superior scleral incision is fashioned. At this point, the lens is grasped with forceps and positioned in the anterior chamber using a handshake technique, and then it is explanted through the scleral tunnel. The procedure then proceeds to the scleral fixation of the micropure lens with CV8 Gore suture. The suture is externalized through the sclerotomies created at the scleral markings. At this moment, the lens is folded and introduced through the scleral tunnel. We can observe that suture entanglement occurs when attempting to tension it. Thus, the surgeon uses a chopper manipulator to stretch the suture. Once this is achieved, the usual 3-1-1 knot technique is performed. However, resistance and difficulty in scent ration of the IOL are noted when tying the suture on the contralateral side, and suture looping around the haptic region is also observed. The same approach is taken, patiently attempting to stretch the suture with the chopper. This type of intraoperative event can occur with scleral fixation techniques using Gore suture. To avoid it, it is necessary to keep the suture taut and pay close attention to the orientation during lens insertion. Although it can be labor-intensive, suture entanglement is generally easy to resolve and does not compromise the effectiveness of the technique. After completing the sutures, the knots are buried. An excellent scent ration of the intraocular lens can be observed at the end of the surgical procedure.